Hello, everyone. It's Dr. Fred, and welcome to my live today. So, today I'm streaming on multiple different platforms, and I have an important topic I want to share with you. The idea here is something that might rock your world, or you might already be consistent with it, or you might be both. Maybe you are already consistent with it, but you've never heard a doctor speak to it, in which case it'll rock your world, even though you already know this to be true. So I'm a psychiatrist. I'm an MD psychiatrist. I was trained conventionally, and I've been a psychiatrist for a little over 30 years. I've been in the mental health field for a little over 40 years, and I've seen lots and lots of patients from all walks of life. I'd say somewhere along 40,000 patients, I've put my signature in their chart. And in that time, I've had an opportunity to see how psychiatry works, how the mental health system works, what mental illness is seen as, and all the different therapies and modalities that are offered to this program, as well as all of the manifestations of what mental health abnormalities or dysfunctions or imbalances look like in all age groups, from people from all over the globe. And here's what I've learned, something that I think you know, which is the mental health system is broken. What do I mean by that? I'm saying that when people walk into that system, they do not get better. This is not a system that is geared towards healing people. If anything, the mental health system even knows that about itself. And in fact, what it calls on for itself is to actually have it that it does, slows down deterioration, which is inevitable. And or sometimes it just contains the condition. It doesn't even present itself or even imply at any level that it has any access to curing or healing those people who are mentally imbalanced, dysfunctional, or in some way seen as abnormal. Well, I have an issue with that. And the issue is that by giving these people the therapies that are provided and by just simply making the claim that a cure or healing is not acceptable or not even imaginable, we in some ways are creating the condition that we are marketing to treat. In other words, there might be a way to actually consider other opportunities rather than a default mental health system to take on whatever your imbalance is that actually would heal and would cure you or your loved ones or the people that you care about. As it turns out, the therapies that are provided often don't work to do anything but maybe sort of quell some of the issues temporarily. So when you come in and you're feeling like you have a mental health condition, like maybe depression, or maybe you're anxious, or maybe you're not completing tasks, or you're feeling funny in social environments, or maybe you have a trauma from the past that is continuing to bother you, or maybe you're having trouble sleeping, or maybe your thinking is going fast, or you're feeling confused. All of these things are considered psychological or psychiatric conditions. And once you decide that you have that, you go to a mental health provider and you let them know that's what you have. And their job is essentially to agree that there's something wrong with you. Now, it's possible, just possible, that there's nothing wrong with you. I think that Krishnamurti said this best, which was, it is no sign of mental health to be, to be sane in an insane world, or to be, to be, I think I'm misquoting him. It's something like that. And I'm so sorry for misquoting him, for bringing him up and then misquoting him. The idea is there's no sign, to be well adjusted. There's no sign of mental health to be well adjusted to a profoundly insane world. And that's really what this world is. It's a profoundly confusing world, and there's so many challenges, so many things going on. It's almost impossible to stay focused. It's not your fault. It's almost impossible not to be depressed about what's going on. That's not your fault either. It's almost impossible not to be anxious or fearful about the future, given what we know in your own community, with your own self, or in the community or society at large. That's not your fault either. So this idea is that we come in to the psychiatric office and we think that there's something wrong with us. And what really the doctor's point is actually to confirm that there is something wrong with you. Psychiatry is one of the only subspecialties out there that when you tell a client there is nothing wrong with them, they actually get angry. That isn't true in most other medical fields. If you go to a cardiologist or you go to a surgeon or you go to an ophthalmologist or you go to nearly any other doctor and they let you know that you're okay, you don't get mad at them. In psychiatry, there's some opportunity to become very angry with the clinician for telling you that you're okay, because you really want confirmation that your behaviors, the things that you're not proud of, the things that you might feel shameful or guilty about, you want to know that that really wasn't you, that that's actually driven by a condition you might have. Now, this is not true for everybody. Some people really do have what they know are conditions, like, formalized conditions, and they're actually happy with their therapeutic intervention, their therapist, their diagnosis, and their treatments, including the medications they're taking. But this is not a conversation that is meant for them. This is a conversation that's meant for the hundreds of millions of people who actually aren't aligned with that, who feel like they are misdiagnosed or underdiagnosed or unlistened to or unheard, who feel like they are not getting proper treatment or maybe getting worse when they want to get better or not getting better as fast as they would hope or expect to. This is that group. So as it turns out, if people are pretty sure that there's something wrong with them and the doctor convinces them that there's something wrong with them, that's when the essence comes. That's when they decide that they need the treatment that is connected with whatever that is that has been labeled and what is wrong with them. And so that's when medications are the default. Medications may not help nearly as much as they are marketed to. Medications, in fact, at times actually increase, advance, perpetuate, or even cause the symptoms they're marketed to treat. So when I learned about that, and I learned about that in the field by taking a group of people off medicine and watching them get reliably better as a group, like I really learned that it's not necessarily medicine that was holding them together. And in fact, taking them off of medicine often meant the disappearance, the actual like, the actual removal of the diagnosis they thought that they had. That's when I learned that these medications or some of the therapeutic treatments actually cause the symptoms they're marketed to treat at times. Because not only did they get better, but their diagnosis actually disappeared. So I started to look, where can we enter this paradigm that we can make a difference? It's not a matter of being mad at the insurance company or the medical field or the big pharma or these very vague esoteric names. There's no such thing as somebody called the insurance company or somebody called the medical field or somebody called big pharma. So where is there such thing? Where can we actually enter this maze and make a difference? And what I learned is that we can enter it at the patient or the client or the customer level. You see, if the customer really knew that there was nothing wrong with them, that it's okay to be confused in a confusing world, frightened in a frightening world, depressed in a depressing world, anxious in an anxiety-based world, challenged in a challenge-based world. If people knew that it wasn't them, that perhaps there was nothing wrong with them in the first place, then they would also know there was no reason to treat what they have. There would be no reason to actually consider that they need fixing, because they would see that having this level of imbalance or this level of difficulty functioning was actually a normal response to the environment that we're living in. This is like blaming a log when it's burning in a fire. There's a fire there and the log burns. You don't blame the log for burning. This is the same kind of thing. This environment is very difficult to manage. And if you're having trouble managing it, all I can say is sort of welcome to humanity. And that's the name of my brand. That's the name of my company. And it actually entails taking into consideration that everything in life is as beautiful as it is because that's what it is. You're experiencing all of life, including the difficult parts, the unspeakable parts, the traumatic parts, the uncomfortable parts, the parts that even have you be in pain or in misery. And all of that in its own self in this short life of ours is part of the exquisiteness of being alive. So if you knew that there was nothing wrong with you, then you would no longer actually need medicine, because you would know that there's nothing wrong with you and there's nothing to treat, there's nothing to fix. So mental illness, therefore, is different in multiple different places, for instance. If you have a broken arm, it's broken in Tibet, just like it is in Singapore. If you visit a different country, you'll see that your arm stays broken. It's broken in Reykjavik. It's broken in Auckland. It's broken in Little Rock. It's broken wherever you are. Your mental illness symptoms, however, are very variable. And if you have a mental illness in this country, it might not be called a mental illness in another country. And it's not because that country's backwards. It's because mental illness has a very vague and very elusive definition for what it really means. So mental illness, because it doesn't have a single definition like broken arm does, or like most words do, is a topic that is a variable. And because it's a variable, it's subject to something called transformation. We can transform the narrative together of what mental illness is. When I was about to travel around the world and see how mental illness was seen through different eyes in different countries, different cultures, and corners of the planet, my intention was to show that there is no firm definition of mental illness. And since there's no firm definitions, it's subject to our own interpretation. So because of that, even if you're feeling uncomfortable or there's something wrong with you, that doesn't mean there's something wrong with you. In other words, just because you think there's something wrong with you does not confirm that there is. Most people actually think there's something wrong with them. So you could make a case that it's actually normal to think that there's something wrong with you. We don't have access to what it means to be normal. So how in the world do we have the audacity to say that we understand what abnormal is or what mental illness is? So that's the two questions I'm asking today. The first thing I want you to get is, in the first place, there might not be anything wrong with you. You might not have an actual deficit disorder. You may not have an excess of anything. You are just uncomfortable and managing this crazy world as it's being delivered to you, both internally and externally. And there are multiple different functions and multiple different interventions that can actually cure and heal. Perhaps the most obvious one is to have someone listen to you, actually hear you, and then actually connect with you and actually resonate and harmonize you with the human level. That level of connection, of human connection, is curative and is healing in its own right. So that's the form that I would invite you to take on with other people who you think there might be something wrong with. What they want more than anything, what nearly each of us, all 7.8 billion of us want, is to be heard for who we are and respected at that level. And mental illness in and of itself is such a variable that it's subject to transformation, meaning we can actually change the definition of mental illness so that it does not represent what we think it does. We often think we're so smart about what mental illness is. Here's an example. 40 years ago, when I was training, one of the biggest indicators of someone being mentally ill was when they were talking to a TV and thinking that the TV was talking back to them. What am I doing right now? I am talking to a TV screen, and the TV screen is talking back to me. So therefore, the whole definition of mental illness has shifted with technology. Had it been real mental illness, none of that would actually take place. It wouldn't be based on the timing of the event. It would actually be something that was firm in its definition. Mental illness is not firm in its definition and is subject to having its conversation transformed, having its narrative fully transformed. And in fact, there might be nothing wrong with you or even them for responding to this crazy world the way you're doing it. So there's, no sign of mental health to be well adjusted to a profoundly sick society. Thank you so much for listening to me today. It's been a great honor to share with you some of my thoughts and ideas, and I look forward to having further contact. If you'd like to have further contact with me, I do have different interventions or different groups that I run. I've written a couple books, and there's an opportunity for you to actually connect with me. And if it's a good fit, we can go ahead together. If it's not a good fit, I have a lot of friends in the field that I can refer you to if you're having some degree of a sense of dysfunction or imbalance or just discomfort. Thank you again. You can find me at drfred360.com. If you go there, hit the contact button and leave me your name and your email, and I'll email you back some of my important information. There's a lot of freebies on that site. You can see where other podcasts I've been on, get copies of my books and copies of my courses that I've created over time. Thank you again. It's been a pleasure and honor, and I will catch you on the flip side. Bye for now.